You don't need to waste hours figuring out how you can practice ultrasound in the UK. In this video, I will walk you through the steps you need to do, whether you are an early career sonographer and you're figuring out how you can get into ultrasound, or you are a student still in school figuring out prerequisites, thinking whether you should go to radiography or ultrasound. This video is for you. And I'll give you an insight to career growth and pay so that you better make your decisions to guide you on your career. Welcome back to my channel. I'm Doris Ojake. I've been a sonographer for over 10 years now. I've been in the education field, I've been in clinical practice, and I'm currently practicing in the UK. All right, so there are 3 things on your list that you need to tick on your journey to becoming a sonographer and practicing in the UK. The first thing is education. All right, so for education, there are 2 pathways that you can follow. It divides up to 3, but it starts from 2. All right. So the first thing you can do is get a BSc in radiography. Now, a BSc in radiography will typically be 3 to 4 years, depending on how and what location you are. So 3 to 4 years, 3 for most courses, and you get a BSc in radiography. All right. Or you can get an associate degree or a BSc in ultrasound. So these are the 2 main pathways that you can take academically from the undergraduates. Now, as a radiographer, you need to specialize to become a sonographer. So you will need a postgrad in ultrasound. Now, the fun part here is that you can get a postgrad in MSK, you can get a postgrad in breast imaging, you can get a postgrad in vascular or just general abdomen and gyne. You can get a postgrad in that. Now you are ready to practice as a sonographer because you have the academic background in that. Whereas you who has a BSc on the undergraduate, right? You have an undergraduate in ultrasound, you are ready to practice after your 2 to 4 years degree. So associate 2 years, 2 to 3 years, associate degree 2 to 4 years, depending on how your program is. Okay, so you are already ready to practice after this time, whereas the radiographer will have to practice as a radiographer after their BSc. While you who have this pathway for your education, you are ready to practice as a sonographer. I'll take it again. Degree, 2 pathways. Undergraduate in radiography, you cannot practice as a radiographer. You cannot practice as a sonographer. So many words. You have to practice as a radiographer. Depending on where you are, you can, if you want to, practice as a sonographer, but I advise a PG set, and most employers will advise a PG set if you are coming from a radiography background. If you're coming from an educational background of ultrasound, you can practice immediately after school as a sonographer. And of course, the next thing that we are moving to right now is the registrations. All right, now, as a radiographer with an undergraduate in radiography, so let's say BSc, radiography, with a BSc in radiography, you have to register with HCPC. As a Healthcare Professional Council, because radiographers is regulated by this council. So you have to register with these people, okay, to practice as a radiographer. Now, as a sonographer, who had their undergraduate degree in sonography only, you cannot register with HCPC because sonographer is not a registered statutory register, it's not a registered title with HCPC. So you cannot register with HCPC. All right. But what you can do is you can register with RCT. This is a voluntary a voluntary registry body. You can volunteer to register with them. But legally, you are not required. There is no statutory body that is legal that you are legally required to register as a sonographer with an undergraduate degree in sonography to practice in the UK. You can also register with the British Medical Ultrasound Society. It's a society. This society will help you with lots of information that you need in your practice as a sonographer here in the UK. You get information about guidelines, you get information about the updates, you get information about little things right down to gel sterility, gel control, how to protect your gel, temperature of your gel. They have lots and lots of information that you will need that will help your practice. But you cannot register with HCPC. All right. Now, when we go down to career, all right, so we've done education, we've done registration. Now let's look at the career pathway. Now, with the career pathway, these guys who did radiography and are registered with HCPC, if you remember from the education, after the BSc, they did a postgraduate course in ultrasound. Then they are now sonographers. All right, so around this time, this is like a reminder time for HCPC professionals to register. So there's a recent article in SOR, Society of Radiographers, which is saying that sonographers should remember to register with HCPC. But if you go into the article itself, it says radiographers who practice as sonographers should register. It stated that clearly, and it goes further to say the point I'm telling you, that sonographers cannot register with HCPC, and they know this. Okay, but if you are a radiographer who is practicing sonography, you have to be registered as a radiographer. It is very important for you to register. You see, I will explain the reason why it's very important for you to be registered when we come down to career pathway. So if you are a sonographer and you are now practicing only, you are a radiographer, sorry, and you are now practicing only sonography, please stay registered with HCPC and renew yearly. Please renew yearly. You have to renew your registration yearly. Now let's move to career pathway. Now we have radiographers, right? Radiographers with their HCPC, and you have sonographers minus HCPC. It's very important. Very, very important. Stay with me. Now, HCPC is the statutory body for allied professions. You have the paramedic, occupational therapies, podiatrists, and all the lots. Now, sonographers are not there. Now, once people hear sonographers, they think radiographers. So they think we have to be registered with HCPC, but you are not supposed to be registered with HCPC. You cannot even register with HCPC if you have your educational background only in ultrasound. So you need to be aware of this and make your employers know, because if you do not know this, everybody you meet will ask you for HCPC and you find yourself in the lost, not knowing what to do. That is why you need to register with the British Medical Ultrasound Society. Now you have all this information on your fingertips and you can educate all the people you meet along your way, because they do not know, and it's not their job to know. It is your job as a sonographer to know all what you need to know about your industry. So please, it's not sponsored, but register with the British Medical Ultrasound Society. The information I've gotten by these people, amazing. Now, career pathway. Once you have this person will go to school for 3 years, and then they will do a post-grad for 1 year. So 4 years, then they work as a sonographer at band 5 or 6. So it's a trainee position as band 5 or 6. Now, how does this work? Some radiographers will be trained at their work by taking a trainee position in their trust, or they will go directly from to school and get a postgraduate certification in ultrasound, all of this to become a sonographer. Alright. So while they are doing all of this, you with your HCPC, you're already practicing and earning. You should be earning at band 6 immediately after school. You should be earning at band 6. So financially, it pays to go to school directly as a sonographer if you're sure that is what you want to do. Also bear in mind that as a radiographer, you have the options to do in so many other imaging departments like MRI, CT, nuclear medicine. As a sonographer, your starting pay is better because you are entering at band 6, and if you are going as a trainee sonographer from a radiography background, you'll be entering at band 5, which is a trainee position. Now, when it comes to career growth, I'm going to take one for the team here and tell you that if you are in the same position with a HCPC radiographer who is practicing sonography, and you are a sonographer, and of course minus HCPC, they will take ROCT now. They're kind of making it as if it's a must, but remember that it's voluntary, and it's a whole lot of stress for international sonographers to apply to this. All right, so these two people, let me take one for the team and tell you what will happen. This person will be promoted before this person because this person has HCPC, and this is what the hiring team, management, and HR, this is what they know. Before this person, I'm not saying this person will not be promoted. This person will be promoted, but after years of, because I know you've been here for long, I see what you can do. And if we are going to open a business, this person will have an easier market entry. Easier market entry as opposed to this person because they are registered. And I'll tell you the reason. Nobody will give you power if they cannot control it. So once you are regulated and you are in a regulatory body, they can control it. If you've enjoyed this video and this breakdown, you will also enjoy. All right, so like I said, we've gone through the education, we've gone through registration, and we've gone through career growth. Now, if you enjoyed this video and the breakdown, you also enjoyed this video right here where I break down how you can register with HCPC from your different educational background. All right, thank you.